Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Alya Khoirunnisa. I studied at the Semarang Health Polytechnic, majoring in nutrition. Here, I will explain a little about nutrition, technology, and dietetics. My presentation provides insight into the adoption and application of wearable or implantable sensor, approach and dietetic technology or implants, and strategies in improving evidence-based public health nutrition education, public awareness, and in improving fitness and clinical nutrition management. Currently, the industrial revolution with food production for economic gain, the obesity epidemic linked to unhealthy eating habits, and overnutrition in both developed and developing countries continue to exacerbate the increase in chronic diseases such as cardiovascular disease, cancer, and premature aging of the population. These challenges are exacerbated by interesting demographic and population, climate and environmental change, and health system, weak integrated policies, management and administration barriers. This paper provides insight into the adoption and application of wearable or implantable dietetics and nutritional sensors and technology approach, and strengths in improving evidence-based public health nutrition education, public awareness, and in improving fitness and clinical nutrition management. It should be defined together as a unique platform for policymakers, nutritionists, dietitians, and other research scientists, physicists, and other public health professionals. Next, we will discuss about dietetics and nutrition technology and the need for intelligent sensors. Dietetics and nutrition technology and the need for intelligent sensors, wearable smart nutrition technology, and sensors of or implant can contribute to stable research and development in food, nutrition and nutrition policy, wellness, and action diet. It should be defined together as a platform unit policymakers, nutritionists, dietitians, and scientists, other research doctors, and health professionals, other community. The importance of determining nutritional intelligence technology and the need for intelligent sensors is very important towards evidence-based early detection and cost-effective nutritional approach and inventance is responding to global nutrition challenge. Thus, the sensor early nutrient detection, informing, education about prevention and control tactics, prevention and reliable regulation of other or excess energy intake or diet unbalance profits now continuous detections and monitoring tools net both for vulnerable population, professional and relevant stakeholders. Next, we will discuss about dietetical policy and platforms and nutritional technology and sensors. In this day and age, the need for shortcuts and accurate, automated, and personally in real time is very important. Detection and wearable or implantable, early sensor monitoring, acceptance and application that can guide in self-education and clinical support system for health profession, especially nutrition and dietetics, important in tackling the threats and epidemic that evolved for humans and the man-made, environmental, and natural challenge and impacts on health. Local, national, regional, and international health organizations, including food and pharmaceutical company partnership and network engagement, and investment in collective research and development, collective harmonization and standardization of the adoption in implementation of studies are essential. This is a real and practical opportunity to gain knowledge about the advantage of nutrition, wearable sensor function and application implementation, skilled advice, collaborative nutrition and dieting source as adds to their passion, cross-sectoral and multidisciplinary healthcare approach and service delivery. In addition, they include approach to nutrition, inflammation, and immunoregulation, such as people living with HIV/AIDS, obesity or weight and pandemic diabetes, that disease and disparatus as ricket, quasicord and maremus, visual impairment, student growth and development, bad education. For disease, the health and economy of most LMIGs, particular Africa, has continued to be hampered by the persistent and revival of the public health risks associated with food and nutritional challenges and poverty that all face. This could include in nutrition and dietetics data and data based or nutritional health information platforms, wearable digital nutrition tools, and awareness and literally coordinated mechanisms to and monitor the activities of all stakeholders, collective and party dialogue and communication among public consumers, dietitians and nutritionists about the need intelligent digital nutrition and food sensors in increasing food intake and quality energy consumption, malnutrition or obesity, informed intervention and fitness programs, approach and balance management quality result. However, addressing and strengths wearable and implementable sensor of devices that are operational and flexible. Data privacy, safety, and security need to be ensured all the times. Recent advances to robotic and digital technology represent an paradigm shift in learning and knowledge, considering behavioral and perceptual or cognitive attitude to smart robotic devices that can be used in nutrition and diet monitoring and evaluation. Evidence-based knowledge of wearable nutrition or implantable technologies and devices about clinical and non-clinical nutrition and dietary politics and in public nutrition therapy support and management is necessary in meeting food and nutritional deficiency and its vulnerable population. Also, in promoting the nutrition and pharmaceutical industry as well as professional inspiration, professionals and educators for advanced nutrition, science and service delivery, understanding contextual nutrition indicators for healthy nutrition, fitness, and the framework for developing food security, and be the most effective and holistic approach in addressing undernutrition and overnutrition. Developing safe, effective, and accessibility sensor or smart wearable or implantable device system in nutrition, imaging and sensing, and robotic in clinical management and rapid monitoring technology has great potential in shaping the future of public health nutrition for both developing and developing countries. Sustainable. Accelerating sustainable investment in agriculture to ensure that all vulnerable population have sufficient access to affordable, healthy food and environmentally sound diets is urgent. Evidence-based and adequate management are necessary implementation in improving nutritional genetics and medical nutrition therapy. There is an urgent need for smart diet and nutrition detectors and monitors that can be worn or implementable at all ages and at all levels to understand and monitor chronic disease risk factors, impacts on health, pathophysical development. Now, conclusion is real-time, effective, and affordable dietetics and nutritional sensor and technologies are evolving with tremendous benefit and a powerful game changer in a public health nutrition in all MHs, especially in Africa. Political, community, and financial investment from food promote nutrition education and awareness of lifestyle adoption for health, support the development of a digital nutrition database platform and necessary communication among public concerns, dietetics, and nutrition. Now I close presentation about nutritional technology and dietetics. Wassalamualaikum warahmatullahi wabarakatuh.